test as a stability measurement that we used before. We wanted to have something really more precise, and especially for the early healing period, because that's something you can't really measure with the period test. You tap on what? On the healing cap. It's a little bit difficult. So we actually looked for patients with edentulous, partially edentulous areas in the posterior sides. In this study, only mandible, and it's healed side. So it's actually an ideal situation. It's really straightforward implant placement. We had 56 implants, and the protocol for the ISQ measurements was at day of insertion, 0, then at 3 weeks, 4 weeks, and 7 weeks, 12 weeks, and 26 weeks, so a long time period. And we decided if it's lower than 65, we wouldn't go for restoration. We would let them heal for an additional 3 weeks. And the contact, so just to show it was a real loading situation, was that if the patient bit on a shim-stock foil, he engaged actually this shim-stock foil. A small slideshow to demonstrate how this is going. A really easy site, single tooth gap, implant placement, here the smart peg, the measurement at the beginning, so it's day 0. You see a high value, something similar to Dr. De Gidi's measurements here also, quite high. Here after 3 weeks, then we had 83, so we go for a restoration, just to show you how this is working. So the results were very interesting, and they are quite similar also to the results that we just saw. The mean values were also about 73 in Dr. De Gidi's study, and we had 74.3 with mandibulary implants. So it's interesting, it's a pretty similar situation, quite high value actually, and over the time period, this value increased, which is also statistically significantly increased. You see that on this box plot image here, 0 day of insertion, and this is half a year later. And if you just place this bar over it, you see it's a steady increase, and all those measurements are statistically different from the day 0, the implant insertion day. Also interesting is the difference a little bit to a similar study with SLA and SLA Active study from San Antonio, where they actually showed a small dip after this time period, which we actually couldn't see in our patient, but maybe it's also because of difference of selection. We had really healed sides, 4 to 6 months, very good bone, and this could be also to small differences here. And you see it's not a huge difference here, it's only 2 to 4 ISQ values difference. An interesting graph, I think, is this one. If you look on gender, you see here that's a 74 to 84. If you look here, male and female, it's pretty similar. There is no gender difference we saw. There is some difference here, but it's not significant. Maybe it's because of numbers. We would have to have a more robust number maybe to find some differences over time, but we didn't see that here. The same is with implant length. We had 2 lengths, 12 millimeters and 10 millimeters. We didn't see any difference here. But when it comes to diameter, we found the differences, and this is the 4.8, and this is the 4.1 diameter, and there's really, from the beginning, and this is important, you see here the average is the same, and here it's really different. So that's interesting and something maybe also to consider when we do measurements and also implant placement. An interesting final finding is also the 2 spinners. We had 2 implants that actually were slightly moving. Now, we didn't move them, but the patient reported discomfort. So we stopped, and with one we could take the measurements, the ISQ measurement. With the other, we didn't dare to remove the cap because we didn't want to remove the whole implant. But we left them there, and you see at the beginning, at the day 0, they had quite high ISQ values. So if you would have loaded them there, we would have probably had 2 failures. They are single tooth implants, not splintered. And we let them heal, and you see after an additional 3 weeks, they catched up and developed actually quite high ISQ values in the range that is the average after 6 months here. So that's an interesting finding. That leaves me with the 3 questions. So I really tried to answer them as you sent them to me. Why should we use that, although we have such high success rates? It's a good question. I mean, 99, 99.5, that's not a clinically significant difference. So why should we use it? And I think the important thing is we want to define the exact time point when we load. It's an elective surgical procedure, normally, implant dentistry. It's something the patient wishes and he pays for, and we should offer him the most objective values to say, now it's safe to load. And I think this ISQ value, in contrast to a radiograph, for example, just tapping with an instrument on the implant, is something we can really put in our charts, like a liability question also. We can say, okay, I guarantee you the initial healing period was uneventful, we can go for the restoration, at least for the early healing period. In the long term, we can't guarantee that he doesn't run into peri-implantitis problem. That's logical. And it's also something for visualization to the patient. The second question, which is the level to be comfortable when I do surgery? I can't tell you really. As we saw here, we had two values way above the 65 ISQ value we took as a threshold. And they still fell down to 38 one. That's more than, it's almost half of the initial value. I think the ISQ value is a dynamic value. And ideally, you try to get as many measurements as you can get, and you see how biology actually is developing, from primary to secondary stability, so to speak. And I think that's actually the huge benefit of this. If you take one smart pack per patient for the surgery and then for suture removal and then before implant placement, you have 3 valuable numbers to give you a little bit more confidence and objectiveness to your actually loading protocol. And the last question, when do I consider it safe for loading? In the department where I come from, we actually have not or almost no experience with immediate loading, so I won't touch onto this topic. But for early loading, we have actually the value of above 65. So we say if you have values above 65, and again I will stress it's dynamic. If I have in the beginning 80, the second measurement I have 70, and in the third measurement maybe 65, I would be more careful. But if it's really stable around or above 65, I would feel very safe to go for a restoration procedure. And if it's lower than 65 and it really falls down, I would just give it another try and leave it there for 3, 4, 6 weeks and then check it again with the ISQ value. So I hope that you have gotten some useful information also for your daily practice the next week. I thank you for your time and I hope you enjoy the rest of these lectures. Thank you very much.
Thank you. Thank you.